Pain in the facial muscles and jaw. This is probably a question I'm asked every day, or maybe every other day. It's a huge, huge subject that I could never cover in a short video. Simply to cover some of the more random pains, some of the strange pains going on, and this is just how I'm thinking at the moment. One of the big problems with following craniofacial dystrophy and a lengthening of the face is that most people relax in one posture, maybe with their lips together but their tongue down, often between the teeth. And then they bite in another position. Then some of them will grind and use heavy loading in that position, which creates two separate positions where you posture, where you bite together, and this difference can cause all kinds of problems because, of course, the body's dynamic, and being dynamic, it will reform to wherever you hold it, wherever you posture. Once that's happened, when you bite together, particularly if you're going to play high forces and loading, you're doing that in a position the body's not balanced in. And the body is in your postural position 90% of the time. It's in your biting tense position 2-3 hours of the day. And this is going to cause awful problems. But the specific things I'm thinking or I'm observing at the moment is that, you know, I've had problems with my knee. And one of the things I noticed was I had a problem with my right knee, and I ended up getting pain in some of the muscles of my left leg and a little bit of my left knee. So what's going on here? Well, it's all of this balancing that's going on. So the knee is the most complex joint in the body, and the jaw joint's the second most complex joint. There's loads of different muscles, and particularly it's joined in the middle. So what happens in one jaw joint will certainly be affected in what's going on in the other jaw joint immediately. Not some compensation that will happen after weeks like my knees, but it goes on immediately because it's the same bone. It's fused down here. It has to be. Look at a jawbone when you pick them up from a dead skull. Now, the body will try to prevent pain. So if you've caused any damage to the jaw joint, then different muscles will try to take over to compensate for that. And as these different muscles are recruited to take over, they're not the right muscles. And if you're putting through them a lot of loading and a lot of work, they're going to shout back, and they're going to shout, and it's far too complex for me to understand. And it will be different muscles around the hole where they engage on the skull that will cause that problem. And of course, as they engage and they pull hard, it's going to be distorting the skull. Now, huge number of the cranial nerves pass through little foramen in the gaps of these plates that make up the skull. Now, I am sure they're going to be crushed and pinched and bruised by these plates moving backwards and forwards as we move from these two separate positions. It would just make logical sense. So it's a thread that I'm working on, and it would explain a lot of the strange problems that people come across. And, well, this is a project in work, so I will get back to you with more information as I uncover this over time.